Welcome to another edition of Someone You Should Know, brought to you by the Ed Morse Automotive Group. I'm Brett Allen. Thanks for watching. Today we are featuring Dr. Michael Thompson, general surgeon and doctor at Canyon Vista Medical Center, someone that I personally have experience with. I just underwent a procedure. I have not gone through many surgeries in my life, and I was a bit apprehensive, but Dr. Thompson and his team put me at ease. And I wanted to share that with the community. I feel that's important to let everyone know my positive experience with Dr. Thompson and Canyon Vista Medical Center. Dr. Thompson, thank you for joining me. Tell me a little bit about yourself, if you would, and what brought you here to Sierra Vista.
First of all, thank you. As you mentioned, I'm a general surgeon. I've been here in Sierra Vista since January of 23, so just a couple of years. I came from central Iowa, where is my home. My wife's folks live in Mesa, and so we've been talking really for the last 10 years about when our kids were done with college, would we like to be closer to her folks? And so when we were looking, we kind of looked all around Phoenix, within, 2 or 3 or 4 hours. And of the places that we looked, we just thought Sierra Vista was beautiful. And of course, the hospital is a nice, what I would describe as a mid-sized hospital. As everyone knows, it's very rural here still, even though, it's a 50,000 population town is a big town to me. The town I'm from about 800 people, even though it was close to Des Moines and really always had access to Des Moines. But, I consider this a big town. So,
How do you like Sierra Vista now that you're here?
yeah, it's beautiful. The weather here is fantastic. When I talk about Iowa, people ask about Iowa sometimes. So Iowa, I think, has 2 good months of the year. It's got April or May in the fall, spring, and then really October is pretty nice. But other than that, it's very humid and hot in the summer. Unlike, here, I always say it could be 105 degrees. I'm sitting outside in the shade and very comfortable. Back home in Iowa, if it's 85 and I'm sitting in the shade, I'm pouring sweat. It's just very humid. And then the winter, a lot of snow, very cold. And it's not even so much that, it's the gray. The sun hides most of the winter in Iowa. So that's one of the things I love about here is the sun is almost always out.
So, Dr. Thompson, what inspired you to get into the medical profession?
So I think, some people know when they're kids what their area of interest is. Someone says they want to be an officer or a firefighter. So for me, I wanted to be one of 2 things. I always loved science. Science, any kind of science I loved as a kid. So I either wanted to be a fighter pilot or a doctor. So, and those 2 things, of course, have nothing to do with each other. But we had a family practice doctor in our town who was a flight surgeon and just a very interesting person. So, as kids going in to get your shots or you get a splinter or whatever and you go in to see the doctor, he was just very interesting. And I think kind of those experiences kind of said, oh, that would be really fun to be, a family doctor. And that's kind of where I started when I was in med school, the idea of being a family practice provider. And then, so how medical school is structured, your first 2 years are your courses. So you're taking biochem and anatomy and so forth. And then the second 2 years are the rotations where you actually go out and kind of, it's almost like an apprenticeship. So you'll spend a couple months with a family practice doc, you'll spend a month with general surgeons, orthopedic surgeons, and so on. So my very first experience with surgery was at Mercy Hospital in Des Moines, where I was doing my rotations. And the very first day, I'd never scrubbed into a surgery. I'd seen surgeries peripherally, like from maybe the corner of the room, but never been scrubbed in, at the operating table. So first thing Monday morning, brand new to this practice, and the doctor I was following got called to the emergency room for a lady who had really bad abdominal pain and her vital signs were a little bit questionable. So this lady had it's called a ruptured ectopic pregnancy. So the pregnancy was in her fallopian tube and had ruptured, and so she was bleeding internally. And those are kind of things, if you don't do something about that in a semi-expedient fashion, people can die. So we rushed her to the operating room, and so she did great. He took care of the problem. But I'm like, hey, this is pretty cool. And so that really appealed to the part of me that likes to fix things. I grew up on a farm, so, everything, we fixed it ourselves, tractors, whatever. And so that's the part of surgery that I really enjoy, is we get to take something, whether it be a bad gallbladder or appendicitis or a colon tumor, and we get to fix it. And so we see those people, before surgery, during surgery, and after a couple times, and then they go about and live their lives, and hopefully, don't ever have to come back for anything. So that's a very satisfying thing to me personally. So, there's a lot of branches of medicine that you're just managing chronic problems. So internal medicine, they're, managing their chronic diabetes or their bad kidneys. And so the thing is really never get better. They're just managing chronic disease, but I couldn't do that. I would go crazy. I'm a fix it and move on kind of guy. So that was really what got me interested in surgery. And it's, no job is perfect, no matter what it is. There's bad days for everything. But for the most part, I really enjoy what I do. The things that I do that aren't so fun is, telling someone they have cancer. So you bring someone in for a colonoscopy. We do lots of colonoscopies and upper scopes. And, so sometimes it's just a routine, person's 60 years old and is due for a screening colonoscopy, and you're not expecting to find anything, and you find the big tumor. And then, you have to say, hey, that's some bad news for you. So, that's something I think all of us do a little bit differently, is, how we give people bad news. But that's really the only part of my job I don't like.
Do you ever find it hard to leave work at work, so to speak?
I guess I've always been gifted with that. It's always been very easy for me to separate work from home. Now, sometimes you bring stress home. It's just a hard day for whatever reason, just really busy, or we had a lot of consults, from the emergency room or whatever. So just a taxing day as far as, work level. But I've always been able, even with bad things, just to kind of take that off like a jacket and leave it at the door. And I've been fortunate. My wife and I have been married be 28 years this year. And so I think that's, I see other doctors that struggle with their spouse relationship. And that's one of those things that they're not able to leave that stress at work, and they bring it home. And that's hard for them. Being a doctor, I think a lot of people think it's all glamorous and we're all rich and it's wonderful. And, certainly it's a great living, but there's definitely negatives. I can't tell you the number of times I had to leave a kid's birthday party for whatever, or, gone for the whole weekend because it's just busy. So there's pluses and minuses, just like everything.
Is there anything else you would like to let people know about yourself?
Sure. So I would say it's just a real pleasure to be in Sierra Vista. I really enjoy it. And, the hospital, I think, is a great little hospital. And what I tell people is we do the routine things, that you need very well. I think we do routine things very well. And then I think that's one of the things we also do, is we know when something should go up to Tucson, to what we call one of the tertiary centers, the Banner University or TMC or whatever. So I encourage people, if you've heard something negative about the hospital from friends or even past experience, our CEO, Sean Phillips, is a fabulous, probably the best CEO I've worked for my entire career. And he really is committed to making the hospital a foundation in this community to help people heal, to get surgery, to get them through heart attacks. And so it's I'm proud to work here.
Well, that's all for this edition of Someone You Should Know, brought to you by the Ed Morse Automotive Group, featuring Dr. Michael Thompson, a surgeon with the Canyon Vista Medical Center right here in Sierra Vista. Thank you for watching. That's all for me, Brett Allen. We'll catch you next time.